Hi, my name is Cameron Stewart, and today I'm going to be talking about the impact that opioids have on young adults. In this presentation, I'm going to give a little background of the opioid epidemic, and then I'm going to talk about the different impacts that opioid use or opioid abuse has on young adults. What are opioids? Opioids are a category of drug that includes heroin and other drugs such as fentanyl, morphine, and others. Many people begin using opioids for different reasons. Some of them use them for chronic pain. Some people may begin using opioids for anxiety or any other mental illnesses. There are a lot of negative consequences when someone starts using opioids. Some of those include overdose and brain damage. It can also damage a person's mental health, as well as impact a young adult's relationships and finances. Even though opioids are not being prescribed as often, pharmacists need to monitor how much young adults are getting and using. Now we're going to talk about some of the history of the opioid epidemic. Around the 1990s is when the opioid crisis really started rising. At this time, pain was becoming more recognized as a problem that needed treatment. The first wave of opioid overdose deaths starting in the 1990s when doctors began prescribing opioids. Then in the late 1990s, pharmaceutical companies told the medical community that people would not get addicted to opioids. However, people started getting addicted to them and deaths related to opioids began to increase. From the mid-1990s to 2010, there was a steady increase in deaths from prescription opioid overdoses. Many people would get large amounts of opioids and sell their extras. This was possible because of patient privacy laws and lack of communication between states. When physicians started to notice the problem, they reworked the prescription guidelines. In 2013, another wave of opioid overdose deaths hit. Most of these deaths involved synthetic opioids and a drug called fentanyl, which was illicitly manufactured. According to the U.S. Centers for Disease Control and Prevention, from 2013 to 2016, overdose deaths from fentanyl and other similar drugs increased 88% per year. Lastly, in 2016, the CDC announces new guidelines for prescribing opioids for patients with chronic pain. Next, we're going to talk about the impacts of opioids on young adults. Opioid use has impacted young adults in many ways. One major way is their physical health. Two different ways that opioids impact young adults' physical health includes premature death and brain damage. In 2019, there were 3,391 overdoses from young adults from the age of 15 to 24. Overdose can be very scary, and they are common for young adults who use and abuse opioids. Research has shown that the brain keeps developing into a person's 20s. This time carries many important social and development changes. This is important because when a young adults use and abuse opioids, they might harm their developing brain. After an examination, researchers found that people that use drugs are 3 times more likely to get brain damage. The nerve cells damaged are in the areas that involve learning, memory, and emotions. Next, we're going to continue talking about opioids' impact on young adults. Opioid use can also impact young adults' mental health. According to a study, mental health disorders are associated with increased risk for long-term opioid use among adolescents and emerging young adults. Many young adults begin taking opioids because of anxiety or other mental disorders. However, over time, opioid use can cause other mental health problems, including depression, insomnia, panic attacks, and fatigue. Opioid use might also affect a person's behavior. They might lose interest in activities or isolate themselves. Next, opioid use can impact young adults' relationships. There are many different reasons for this. One main reason is lying or loss of trust. A person may lie to their loved one to hide their opioid use. Another reason includes a person using opioids may get violent. Using drugs can sometimes lead to violent behavior. It may start with a small argument with a coworker and then turn into something bigger. Lastly, using and abusing drugs can impact a young adult's finances. Drugs are not free, and people that are addicted to drugs may do whatever they have to do to get the money. This can lead to using up savings account and running up debt. After a person has used up all their money, they might try and get money from someone else. This has led to an increase in elder finance abuse. Next, if a person decides to come clean and stop taking drugs, rehab can be expensive too. In-person rehab can cost anywhere from $12,000 to $60,000. Next, we're going to finish off the conclusion. Today, opioids are not getting prescribed at the rate they once were. However, pharmacists need to closely monitor the young adults getting them. If young adults are not monitored, then more people could use opioids and possibly have an overdose. Besides doctors and pharmacists, many other people can help young adults from abusing opioids. In conclusion, if pharmacists or doctors start monitoring young adults and what they do with their opioids, overdose rate may go down. Lastly, this is my works cited page for all the information I have on this presentation.